Hello everybody, how are we doing today? So today we're gonna be going to learn about the intraoral and extraoral examinations. Okay, so here are the objectives. We're gonna define intraoral and extraoral examinations, identify the anatomical structures assessed during the IOEO examinations, explain the purpose of this examination is in detecting oral cancers, systemic disease, or infections. We're going to implement this knowledge and findings in real life situations. We're going to differentiate between normal versus abnormal findings, evaluate decisions regarding referrals and follow-up exams, and document findings with proper terminology. Okay, so I want to start off with some facts and statistics. So in 2024, approximately 396,937 people were living with oral cancer in the United States. Head and neck cancers ranked 8th in cancers worldwide with an annual incidence rate of 600,000 people. The National Cancer Institute 2024 reports an estimate of new cases of oral cavity and pharyngeal cancers to be 54,450, being 2% of all new cancer cases. 80% of cancers can be cured by early detections. Studies have shown that visual and tactile examination of the structures of the head and neck and the oral cavity are effective in detecting abnormalities. And so I have this question here. Why is it important for dental professionals to perform oral cancer exams? We're not going to answer this right now, but we're going to answer at the end of the lecture. Okay, so what is intraoral and extraoral examinations? Intraoral and extraoral examinations are comprehensive oral screenings performed by dental professionals to detect cancer, infections, and any other condition in the neck and oral cavity. So intraoral exam focuses inside the mouth, and extraoral exam focuses outside of the mouth. Here are some description words that we want to use whenever we find something. We want to be very specific in describing these lesions. We want to know where is it? Is it localized, generalized? Is it on one side or both sides? We want to know the color, the symmetry, the texture, is it rough or smooth, the consistency, and the diameter. We want to know what size it is. We want to be very specific when describing these lesions. Okay, and then I want to show you guys this video for the extraoral and extraoral screening.
The thorough health history, and then explain, I'm going to be doing an oral cancer screening on you to make sure that everything is healthy. So please let me know if there's any tenderness. Observe their overall appearance, including their gait, their posture, any mental or physical limitations that they might have, their skin, eyes, lips, and neck. Then check the hairline. Then with gentle pressure as you palpate everywhere, bilaterally check the temporalis muscle. Then have the patient move their hair, if needed, and bilaterally check the occipital nodes below and above the hairline. Then bilaterally palpate the post-auricular nodes behind the ear and the pre-auricular nodes in front of the ear. Be sure to extend all the way from the top to all the way to the bottom. Then evaluate the temporomandibular joint by placing the fingers on the joint and having the patient open and close slowly, then quickly, then jetted forward and jetted back, then left to right. While here, you can bilaterally evaluate the masseter muscle clenched, then unclenched. Then spread the palms over the cheek and evaluate the parotid gland bilaterally. Then locate the antegonial notch on the mandible, then slide both hands towards the midline and press the fingers upward to evaluate the submandibular salivary glands. Then evaluate the submandibular lymph nodes by pushing the tissues to one side and then with the other hand pulling the tissues and the lymph nodes over the border of the mandible. Then by digitally roll the submental node over the mandible for evaluation. Then evaluate the medial nodes by tilting the patient's head left and downward to find the sternocleidomastoid muscle right at the bottom of the neck. And by digitally roll the medial lymph nodes over the muscle all the way up to the ear. Then digitally evaluate the posterior cervical nodes all the way back down in circular motions. Then evaluate the supraclavicular nodes and repeat on the opposite side. Then move forward and bimanually palpate the sinuses. Then watch the patient swallow to evaluate the thyroid. Then place the left fingers between the sternocleidomastoid muscle and the Adam's apple and gently press it to the left. Place the right fingers between the Adam's apple and the muscle of the right side and have the patient swallow. You'll then repeat this on the opposite side. Be sure to consult as a team on any other evaluations that need to be added in.
Okay, I just want to show you guys that video that we have a visual of these landmarks. So for an extra-oral examination, we want to look at the symmetry, we want to look at the facial appearance of the patient, we want to look at the skin, their lips, the lymph nodes, the salivary glands, and the thyroid gland in the TMJ joint. Okay, so the facial appearance and symmetry, we want to observe our patient's facial experience, their expression, and posture. The symmetry allows to identify any abnormalities like neoplastic growth or any discrepancies with each side of the face. For the skin, we want to look for any lesions, any acne, moles, or any signs of possible abuse. We want to gentle palpate all over the face and observe the patient's face. For the lips, we want to examine the lip symmetry, texture, and color. Some common conditions that we can see on patients is angular cheilitis, Candida albicans, nutritional deficiencies, or herpes viruses 1 and 2. For the lymph nodes, major lymph nodes in the neck and head should be palpated. Look for any enlargement, any tenderness, or fixed nodes. As we saw in the video, the hygienist was going all over this lymph nodes. The occipital, auricular, postauricular, preauricular, the anterior and posterior cervical nodes, the supraclavicular, submandibular, and submental nodes. Salivary glands should not be palpable. Look for any signs of pain, enlargement, and blockage. We're looking for the parotid and the submandibular glands. For the thyroid gland, it should not be visible and not palpable. During swallowing, the tissue around it should be elevated smoothly and symmetrically. For the TMJ, look for opening and closing pathways. We want to look if there's any deviations, abnormal sounds like clicks, crepitus or pops, any pain, and limitations in opening. Here is the video for the intraoral assessment.
Evaluate the lip area and labial commissures. Visually check the maxillary and mandibular anterior and posterior vestibule areas. This is a great time to check each of the frenum and attached gingival areas. Visually assess the buccal and labial mucosa. Then palpate bidigitally the labial mucosa, and then bimanually palpate the buccal mucosa using the middle and ring finger so as not to smear the saliva across the cheek. Examine the structures on the ventral tongue and floor of the mouth. Examine the structures on the dorsal tongue, and then the lateral borders of the tongue by wrapping gauze around the end of the tongue and then pulling it left and right. Be sure to take your mirror back there for illumination and indirect vision of this hard to see area. While I have my mirror, I will check the maxillary tuberosities and retromolar pads as well. Then have the patient protrude the tongue and digitally palpate the tongue. Then reach far back under the tongue and bimanually palpate the left and right side. Once again, using the middle and ring finger under the mandible as not to smear saliva. You can test the function of the submandibular gland by wiping the Wharton's duct with gauze and compressing next to it with a cotton tip applicator. Note how long it took for the saliva to appear. You can do this as well to test the parotid papilla on the Stetson's ducts. Then assess the hard and soft palate structures, and then have the patient say, ah, to relax the lower and posterior portion of the tongue and evaluate the uvula, anterior and posterior fascial pillars, and tonsils in the oropharynx area. Then palpate the anterior hard palate without going too far back to stimulate the gag reflex. Then document any abnormalities.
Okay, so for the intraoral examination, we want to look for the oral pharynx. We want to look at the back of the mouth, see how's everything looking. The anterior and posterior pharyngeal pillars, the tonsils, the subpalate and the uvula, the hard palate, the buccal and labial mucosa, the floor of the mouth, tongue, and salivary ducts. Okay, so for the oral pharynx, we want to use a mirror. We want to visualize the back of the mouth. The tissue should look reddish pink. We should look for any asymmetry, any changes in color, any lesions or inflammation. The anterior and posterior pharyngeal pillars, same thing. Look for symmetry, lesions, erythema, or swelling. For the tonsils should appear rough pink with brighter surfaces. Look for swelling, asymmetry, difficulty to swallow. Usually during sickness, this might appear red or swollen. And always ask your patient, question your patient if they have been sick or if they feel like they're gonna be sick. The subpalate in the uvula, papilla subpalate, it should appear reddish pink and soft. Again, look for any signs of lesions and pain. The hard palate, some normal structures of the hard palate is incisive papilla, the raphe, and the rugae. Usually we can see the palatal torus in some patients. The buccal and labial mucosa, we want to start our fingers and palpate the mucosa. The tissue should be moist, pink, and soft. Look for any traumatic injuries like burns, cheek bites, and ulcers. Some common pathologic findings that we can see in the buccal mucosa is leukoplakia, lichen planus, aphthous ulcers, and pemphigus vulgaris. The floor of the mouth, we want to, examine the floor of the mouth visually and with your patient. Some findings, some pathologic findings that we usually see is ulcers, frenula, or ankyloglossia. The tongue is the most common place for cancer to occur, so we want to be very diligent when we do the exam. We want to gently hold the tongue with the gauze, pull it forward, and move it left to right. Normal findings, fishery, scalping, migratory glossitis, and then some pathological findings that we can see in some patients is hairy tongue, candidiasis, or glossitis. Salivary ducts, as we saw in the video, we can stimulate the Stenson's and the Warden's duct. The Stenson's is near the second molars and the Warden's duct is under the tongue. Okay, so why is it important for dental hygienists to perform IO and EO exams during routine cleanings? Oral cancer screening is a crucial procedure during routine cleanings, not only for the early detection of cancer, but for infections, diseases, and any other serious condition. Doing these exams provides patients a comprehensive assessment during dental treatment. So we're not only cleaning their teeth, we also, looking at the overall health of their mouth, their head, and their neck. Okay, so it's time for a quiz. Log in into D2L and complete the quiz. You guys have 10 minutes for 10 questions, okay? And then after that, we're gonna be doing the lab section. So everybody's gonna find a partner and set up a room with proper barriers. Everybody's gonna take turns to look at each other's mouth. You guys are gonna follow the checklist that I gave you to look for the anatomical landmarks. You guys are gonna have 20 minutes. Ask any questions. Everybody's anatomy looks different. And at the end of the 20 minutes, everybody was gonna be tested. Okay. Here are some references. Well, thank you for listening to this.